Hello chickens! Welcome to my channel. Today I'm going to be giving you 50 facts about EDS. Now if you like this video then let me know and might make it into a little bit of a series. So without further ado, let's get cracking. Ehlers-Danlos syndrome is the name given to a group of genetic disorders which are caused by a defect in the protein collagen. Collagen is the glue that holds our bodies together. It's what gives our tissues the strength. It connects and supports tissues in our body, including skin, bone, muscles, tendons, cartilage, and organs. So there's not really much that escapes symptoms, unfortunately. There are various types of EDS. They're categorised into different types depending on the gene mutation. Many of the symptoms within the different types kind of overlap, so sometimes it's hard to differentiate one type of EDS to another. It affects everyone differently. Some people get really mild symptoms, whereas others might get debilitating symptoms. There's no cure for EDS. Scientists have yet to discover a way of reprogramming the genes to fix the problem that initially causes it and other genetic conditions. Medical therapy relies on managing symptoms and trying to prevent further complications. EDS is an inherited condition and it runs in families. It's passed from parents through material contained in the nucleus of a cell called genes. Genes control how the cell and the body works. Now, everybody has 2 copies of each gene in their body and 1 inherited from each parent. The gene alteration that causes EDS can happen for the first time in one person, so there might not be any previously affected family members. EDS is usually diagnosed with the use of clinical symptoms such as extreme joint looseness, unusual skin qualities, and along with family history. Fatigue is common with most types of EDS. People often feel that they need to conserve their energy and pace activities. It's important to have a good balance between rest and exercise. Gastrointestinal manifestations are common amongst people with EDS. It can manifest in any part of the GI tract from your mouth to your bottom. Structural abnormalities of the gastrointestinal tract. Where's that? Structural abnormalities of the gastrointestinal tract are also common due to the fragility and extensibility of the connective tissue. Patients with EDS have thinner skin than normal, so easy splitting of the skin is also common. Wounds can take longer to heal, and stitches often need to be left in longer. People with EDS are often described as clumsy and might fall more often. This can be due to poor joint and muscle control that's associated with joint laxity. Most of the different types come with easy bruising. This is due to the fragility of the blood vessels. Makes it hard for blood vessels to close themselves after they've been injured due to the problem in the structure of the underlying connective tissue. Blood vessels are more easily damaged as the connective tissue that's holding them together is abnormal. Varicose veins can be a common finding in people with EDS. This is a sign of how fragile the tissues are, and in some cases it can be extreme. Dislocations can be common, and it's really important to strengthen the muscles that support the joints in order to try and prevent them. It's important to avoid heavy lifting, contact sports, and keeping your joints in one position for lengthy periods. Sometimes the tissues that are holding the bowel are so stretchy and the pelvic floor muscles are so weak that the bowel can literally ball out of the body. It's known as a prolapse. It can be very painful and the tissues can become really inflamed. Physical therapy and exercise can be used to help strengthen the muscles and stabilise a joint, as dislocations often happen because of the connective tissue being so weak. Braces are often used to try and minimise joint dislocations. Postural orthostatic tachycardia syndrome is one of the secondary conditions related to EDS. It's characterised by the body's inability to make the necessary adjustments to counteract gravity when standing up. So basically, we're kind of allergic to gravity. There's another video all about POTS on my channel. I'll pop a link below. Common manifestations of EDS include diverticular of the intestines and or bladder, megaesophagus, megatrachea, megacolon, and spontaneous pneumothorax, which is where you get air trapped next to your lung. Hernias are sometimes common with EDS. The typical factor of EDS is loose joints, meaning that the limbs bend more than usual. Some children who are affected can actually take longer to sit, stand and walk due to floppy joints during infancy. EDS can mean that we're often faced with digestive problems. Our stomach's often super stretchy, so food can stay in there too long. And this is called delayed gastric emptying or gastroparesis. Loose joints can cause a lot of strain on nearby muscles, ligaments and tendons. They too are sometimes lax, and due to this, the strain on them can often cause them to turn to spasm, which can cause pain and stiffness. Chronic neck strain can be another manifestation. Our shoulders are too loose, and due to the weakness in our shoulders, but also on the neck as well, the ligaments that are meant to support the head are too loose and can't do their job as well, meaning that the neck muscles have to do a lot more of the work in supporting the head, and they can become very strained. Ligaments that support the lower back and the spine are often too loose, which can put extra strain on the muscles to try and support the upper half of the body. Loose hips can put strain on the lower back to try and stabilise the pelvis. The piriformis muscle, which is at the base of the pelvis, often has to play a bigger part in supporting the pelvis, which can strain it. When the muscle is strained, it can tighten up and pinch the sciatic nerve. This can then result in sciatica, which can be felt in the buttock, and it can also radiate down into the leg. Disc problems are sometimes more common. The discs that help to support and cushion the spine are often less rigid than usual. Disc problems in the lower back can cause pain in the legs, and disc problems in the neck can cause pain in the arms. The jaw, or the temporomandibular I can never say this word! Temporomandibular joint, TMJ for short, is often loose, which can lead to strain on the muscles surrounding it. Lax joints can make people more prone to headaches and migraines. Some can be triggered by blood pressure or hormonal changes. The esophagus can be too stretchy, and this can result in reflux. Our stomachs contain acid, and the esophagus isn't meant to hold this, which can then in turn cause acid reflux and heartburn. If reflux happens a lot, it can cause serious burning or scarring of the esophagus. The intestines can stretch far too easily, which then increases the risk of bloating, constipation, and it can make gas extremely painful. Lots of people with EDS are often diagnosed with irritable bowel syndrome, when in fact the symptoms and the cause are sometimes physical and down to other things. Tears in the abdominal wall muscles can be quite common in people with EDS. The fibres that connect the muscles tear rather than the actual muscles themselves, which then can make a gap between the muscles. Small parts of the intestine can then push up through that gap, causing pain. Pressure can then build up behind the segment, which can then cause more pain in a larger area. Eventually the intestine that's pushed up does fall back into place, and the pain depends on the movement of the bowel content and contractions of the intestine, so it can be quite random. Women can have an increased risk of uterine prolapse. The ligaments that support the uterus can be weak, and then the uterus can slip and press on the bladder. Excessive stretchiness and weakness in the tissues of the pelvis can increase the risk of rectocele and cystocele. This is when the rectum or the bladder push on the walls of the vagina, also known as a prolapse. Interstitial cystitis seems to occur more frequently in people with EDS. It can cause recurring discomfort in the bladder and in the pelvic area, and some people can experience intense pain, frequent and sometimes painful urination, and really bad pelvic pain. If the bladder's too stretchy, then it might not empty completely, or signals can be sent to the brain say that your bladder is full when it isn't. Patients appear behaviour to make extra adrenaline. If our bodies get too tired, it can respond by making more adrenaline. So unfortunately, we don't realise how tired we actually are. The more run down someone gets, then the more sensitive they become to adrenaline. So we might not actually feel tired when we are. This might make us push through the tiredness, and when the adrenaline actually wears off, we collapse. This can also be a factor in developing illnesses such as chronic fatigue syndrome. When we do fall asleep, our bodies might continue creating this extra adrenaline overnight. This can result in shallow, dream-filled sleep and waking up feeling unrefreshed. Adrenaline's also stimulated by pain, which can make restful sleep more difficult.